Some 700 South Koreans will be evacuated from Wuhan via chartered flights starting tomorrow. Upon return, all of them will be held in isolated facilities for further monitoring. Shin Se-min sheds light on government efforts to contain the virus.
The evacuation plan to bring South Korean nationals back home from the Chinese city of Wuhan, currently under complete lockdown, is all set to go. South Korean government said it is dispatching its first flight out to Wuhan at 10 a.m. Thursday with a joint response team of 20 people headed by Second Vice Foreign Minister Tae-ho and staffers from the National Medical Center on board. The second flight out is at noon, and the remaining 2 flights will carry out the same mission on Friday. The chartered flight leaving Incheon, unlike previously announced, will only be bringing back nationals who show no sign of symptoms, as the Chinese authorities remain firm in keeping those with symptoms from leaving their borders.
Although the government is bringing in Korean nationals with no symptoms, they will be held at a temporary living facility for 14 days out of public health concerns. In order to prevent the potential inflow of the virus, the government will thoroughly inspect all entrants.
The Foreign Ministry said it is closely communicating with Chinese authorities to ensure their cooperation in proceeding with the evacuation plan, a day after Korea's top diplomat spoke on the phone with their Chinese counterpart Wang Yi for Beijing's support. After going through a screening process at Gimpo International Airport, entrants with no sign of illness will be held at a temporary living facility for 2 weeks in view of the virus's incubation period. They will all be put into isolation at 2 different public facilities in Asan and Incheon and Chungcheongnam-do and Chungcheongbuk-do provinces, respectively. Facilities are Asan Police Human Resources Development Institute and Incheon National HRD Institute, with each entrant from Wuhan being allocated 1 room per person. The Korean government is also rolling up its sleeves and operating its response hotline. The Korea Centers for Disease Control and Prevention have dispatched additional workforce to receive calls from people reporting symptoms through the government hotline 1339. All treatment expenses for patients with the coronavirus, including those associated with isolating patients, screening suspected cases, and treating those infected, will be covered by the South Korean government. The Health Ministry said all expenses will be split between the state, the National Health Insurance Service, and local governments. As of January 28th, in South Korea, there has been a total of 4 confirmed cases of coronavirus, and the government has raised the alert level for infectious diseases to the 2nd most severe level. Shin Se-min, Arirang News.